back over the past few years, the planning for this remarkable new Sherman Hospital, I think it's probably a little bit like what it's like to give birth to an elephant, you know? But in this case, the gestation period is 8 years. This is indeed a wonderful, it's a unique structure. And it's a lot more than a place where your mothers or fathers or sisters or brothers will work. It's where they will carry out Sherman's mission to provide outstanding health care and service every life, every moment, every day. But the thing, my friends, we need to constantly keep in mind is that as remarkable as is our new building, as good as the planning and craftsmanship to build it, as superb as the equipment and physical plan, it can never be better than you, because you, our Sherman family, at your best is just unstoppable, you know? You. You will breathe life and purpose and meaning into the steel and the bricks and the mortar. You're part of a high calling. You make possible the fulfillment of our mission. Again, you do it every life, every moment, every day. And as our church so appropriately say, this is a new day in healthcare. As we approach the holiday season, I cannot think what a fitting, what an appropriate gift the new Sherman is for our community and for our area. And I am thankful, and I am so eternally grateful for the privilege of being part of this journey with all of you. What a great adventure, and the best is yet to come. It's with pleasure, it's with a tremendous sense of pride that I welcome you today and ask you to share this exciting time in Sherman's history and the history of our community. Welcome to Sherman Hospital. Thank you.
Good morning, Sherman. Good morning, Sherman, brother. Isn't this a great, great day? I'm Terry Dunning, Chairman of the Board of Sherman Hospital. And on behalf of the Board of Directors of Sherman, we'd like to welcome each and every one of you to this great, great, great facility. And I've been involved in the planning of this from day one, from the time that we originally talked about building a couple of towers over on Center Street. And when we finally realized we needed a new place, we needed to move. We needed to move someplace else, and we spent quite a bit of time looking for the proper place to move to. And this is what we found. We're just absolutely delighted as far as the Board of Directors, and I think everyone else concerned with Sherman is that we found this location and we were able to put this great building together. You know, as you walk through this building today with your family and your friends, make sure you go by the geothermal lake. You know, try to get to the emergency room, the bed towers. You know, I've been walking through the hospital now I've been walking through it for quite a long time, but several times in the last month, and I'm just awed every time I see something in this hospital. Operating rooms, emergency room, everything that's here. You know what? The reason this thing looks so great is because of all of you. You really have your fingerprints on this particular building. You know, you did a lot of the planning, you've helped the board, you've helped the planning committee, you know, make sure that this hospital is the hospital of the 21st century. So thank you very, very much. It's a great day for Sherman, and I hope you have a wonderful time. Thank you.
Thank you, Terry. My name is Rick Floyd. I'm the President and CEO of Sherman Health, and I can't tell you what a pleasure it is to be here with you today. How do you like your new home? Me too. And I got to tell you, having a facility like this is going to create the perfect platform for our broad ambition. Because in the past we might have said, well, we didn't have enough space or old buildings or whatever. No more excuses. And now, you know, we are in a place where we can see our vision clearly and we can realize it. We can become that best community hospital in the nation from a place like this. And I got to tell you, there's nothing in our way. The thing that gives me the most confidence for the future, though, is not this beautiful building. It's the people I see before me. We have the best people in the United States of America right here at Sherman Health. And I want to just take a moment to thank all the people who are wearing shirts of this color, because every single one of them is volunteering their time, and most of them are leaders here at Sherman who are giving up a day of their weekend. And I have to tell you, as you heard from Rick and Terry, this project has spread across nearly a decade. And across that time, the leadership at Sherman, as most of the staff at Sherman, have ended up having 2 jobs. Their regular job plus preparing for this new facility. And I want to thank each and every one of you from the bottom of my heart for all that added effort. And I hope today, when you bring your families to look at this place, you can say to yourselves, that was time well spent, and it's going to create a brave new world for Sherman's mission of service. So thank you very much for that part. I just want to close by reminding each and every one of us that healthcare is ultimately about people. It's about people helping people. And this new place is going to create an even better opportunity for us to make those personal connections each and every day. So thank you for being here today. I look forward to sharing our journey to excellence with you as we become that best community hospital in the nation.
Well, good afternoon. We're going to be cutting this ribbon in a moment. I'm Linda Deering, Executive Vice President and Chief Operating Officer, and I just need to hear from you, though, because this is the first public event we've been holding in this building. This isn't about moving in equipment and educating staff. Did we choose the right event to do first, employees and families? Yeah! Because this is your building, this is your legacy, this is your hard work that has made this beautiful medical campus a reality for us here today and for many years to come. And I know that our employees know this story, but I want to tell this story one more time for the benefit of our family members, who I know you understand who we are, but I want to emphasize the point. When I joined Sherman Health System about 4 years ago, I was meeting with Rick and he was saying, gee, Linda, I'd really like you to come and help us achieve our vision for the future. And I said, well, gee, Rick, I know all about that new building that you and Terry and Rick and the board and the community have already started. How can I help? And Rick Floyd opened a drawer. He didn't miss a step. He pulled out a piece of paper and he said, well, Linda, this is where we're going. And on that piece of paper was written the vision for our future, which is to become one of the best community hospitals in the nation. I literally got a shiver down my spine and I said, you know, this is amazing and I would love to be a part of that journey. And now those 4 years have gone so fast and we get to move our outstanding healthcare practice and service delivered by the people here today into this amazing new building. I couldn't be more grateful for this opportunity, and just like you, couldn't be more proud of the work that we're going to be putting into the building. And now with both elements of the perfect recipe, there's nothing stopping us from becoming one of the best community hospitals in the nation. Thank you for being here today.